Good evening, William and Mary. Thank you for joining us tonight. I shared last month that we'll be holding town halls and community conversations throughout the fall with the goal of providing as much transparency and clarity as is possible in this incredibly uncertain time. So here's the game plan for tonight. We have three basic phases of the hour. The first thing we want to do is share the basic framework for decision making that we're using, based decisions, using the data coming into us about public health and other kinds of data that is changing rapidly. And the second is to get very concrete about how William and Mary is going to be different this fall so that we can live and work together in the varied ways that students and faculty and staff need and respect our neighbors and our communities. So tonight's an overview. We're focusing on the most frequently asked questions, and we'll be taking some questions live in the third phase of the hour. We'll have a town hall for families tomorrow and one for employees on Tuesday so that we can go deeper into the issues that we're scanning tonight. I'm going to kick things off just by reminding everybody what our goals are for this year. Our top priority is to safeguard the health of our community using every tool that we have in our toolkit. And the second is to ensure that our graduate students, our undergraduates, and our professional students can complete their degrees on time. There are real risks now. We're seeing this as we scan nationally that many college students and graduate students are going to lose momentum this year. We saw in the spring just how negative the impact of isolation was on learning for all of our students. And for a significant number of students, we saw real barriers to learning remotely. Those at most risk are low-income students, first-generation students, students in Black and Brown communities that have also been the hardest hit in health and in their finances by pandemic. We see that the barriers to learning remotely are significant, and so are the barriers to engaging in collaborative research, in access to professional and career networking, in all of the components of an on-ramp into the futures that our students are crafting and pursuing for themselves. Similarly, we saw that for our employees in those same communities, the barriers to working remotely are quite high. So from the beginning, we have been focused on how William and Mary delivers on our core mission in a way that emphasizes care for the many different parts of our community. We knew this year was going to require adaptability far beyond what we've ever done before. We needed to ensure really good access to learning and resources for those who didn't have that. We needed to sustain a strong sense of community and connection via many different technologies at a distance. And we needed to change work expectations and environments to protect the health and livelihoods of our employees and change student conduct expectations for the same reasons, to protect their health and the health of our employees and to protect our communities that we live in. And finally, we needed to respond to financial and other impacts on families and our employees. So those are the interests that we're balancing using the data that we have, making real-time decisions. And that's going to mean adjustments like last week. We expect that we may need to make further adjustments going forward. So recognizing just how challenging that is for all of us to live with, we wanted to give you an overview of how we're making decisions. The two most frequently asked questions are first, what changed last week that led to our slowing the phased return of students and announcing that on Friday? And then what data are we tracking? What's the data that's meaningful here scientifically? So we're going to spend about 15 minutes with our leaders here in conversation about that. And then we're going to shift gears to a conversation about risk and how families might think through the right learning environment for your students. And then we'll spend the remainder of the hour, which we hope will be around 20 minutes, in a speed round to cover as much ground as possible. We want to be very concrete about what the semester is going to be like. So we'll talk about testing, we'll talk about rules of conduct, we'll talk about teaching and learning, and we'll talk about steps we're taking to partner with the Williamsburg community to ensure the health and safety of our neighbors. So 3 phases of discussion tonight. It's my pleasure to introduce our participants. our Provost and Chief Academic Officer, Peggy Agouris, our COO, Amy Sebring, who chairs our Public Health Advisory Team, our VP for Student Affairs, Ginger Ambler, Dr. Virginia Wells, an infectious disease expert and our Chief Medical Officer in Athletics, also a member of our Public Health Advisory Team, Professor Carrie Dolan, who's on the faculty at William & Mary in Health Sciences, an epidemiologist and also a member of our Public Health Advisory Team. Professor Dolan's going to be moderating. Welcome, everybody. Welcome, panelists.
Welcome, everyone. We're starting out with a big picture question. William & Mary chose to be flexible in person, and hybrid and remote, instead of going all online. Why'd you make this choice?
So I'll field that one because it's a big picture question. You're absolutely right. We have planned from the beginning to ensure a very robust remote experience, as well as pursuing, because we know for many of our students it's the best scenario, as well as pursuing an in-person experience. And we knew 4 things at the beginning of the summer. We knew that for many students, the best scenario would be all in person. We were hearing that very, very steadily from students and families. We knew that many would choose to study remotely or would need to, and we wanted to be sure that that wasn't a secondary experience. That was a primary experience that we focused on and made really excellent. We knew that we might have students on campus, but taking classes remotely, because that was going to be important for our faculty and staff, and also because the environment might change, and that we might be forced in the worst case scenario to go all remote if the governor were to issue another stay-at-home order. So we were planning with that range, incredible range of eventualities in mind. I shared already what we learned last spring, just how much a negative impact isolation had, and also how many more students had real difficulties with learning remotely than we would have guessed before the spring. So we're not losing track of what we learned. We're keeping that in mind, at front of mind, looking to ensure that it's a level playing field and that students have the kinds of environments they need, graduate students, professional students, and undergraduates. We also recognize, this is the last thing I'll add, and then invite others to say that the pandemic is going to be here for this year, at least. It's not just a matter of weeks or even a few months. And so some students won't have better options. They won't have alternatives. Many may, but we want to be sure that we make it possible for people to have the best options that could be available to them given the conditions that we face. Ginger, do you want to jump in?
Sure. I'll just add that our experience in the spring was we just learned that students in learning from in a remote manner struggled more than we thought that they would, whether it was for technology needs or whether it was lack of an environment where they could have the privacy or the ability to connect appropriately at the right times to do what they needed to do to be successful. So we are hearing from students and their families that they want to be in person. And we concur that the cost of not being in person is high. So we're trying to respond to that.
Provost, did you have anything to add?
Well, I want to emphasize what Ginger said, which is actually that the students, we heard them loud and clear about how they wanted to be back and what they experienced and what they would like to experience. We took the opportunity to think of how we can improve the fall, summer and fall, because we are not as surprised as we were in March. And overall, it was a process that enabled us to first understand what works best for our students and how they learn better, but also to consider how we can learn from what we have experienced so far and improve and provide what the expectation has been all along, a high quality William & Mary experience.
So President Rowe, what has that changed in this last week?
Yeah, that's the question most people have reached out on. So mid to late July, we saw, as everyone knows, much worse trends nationally, rising infection rates. And our local public health picture in the Tidewater was a really significant late July surge. We were making a decision about how to respond to that shifting environment when the governor's order came down last week. And as it did, and in the time since, there have begun to see slower rates, infection rates slowing pretty significantly. We'll talk more about that in a second. We were really encouraged by the governor's order because it added restrictions that we think will improve our success. So limits on occupancy in bars and restaurants and on large gatherings, limits on the sale of alcohol after 10 o'clock, really meaningful. And when we looked at the reasons for the surge, they were directly related to non-mask wearing congregations of large numbers of young adults in bars south of us. Knowing that those restrictions were going to make that really unlikely to happen, we felt more confidence. We also needed to adjust our plan. The 50-person limit on gatherings did change things for many of our schools, and so we need a little more time on that. And we wanted to watch the trends and see that that trend downward was one that would continue.
So Ginger, this question is for you. I am really interested in knowing how you decided which students to bring back before Labor Day and which ones you decided to bring back after Labor Day.
It's a great question. And I imagine our returning students would attest that we support the successful transition of our new students to William & Mary by providing them with a really robust foundation of both information and relationships. And so this includes a thoughtfully planned and executed orientation to the environment, to our resources, and to peers. So bringing freshmen and transfer students back allows us the opportunity to give them that firm foundation as they start their William & Mary experience. Additionally, new students, because they are new to our community, tend to focus their activities on campus. They can't bring cars with them. So it's more likely that they will be here on campus with us. We also want to make sure that we're starting things off in a closed campus experience so we can start building the norms that are going to allow the entire campus overall to be successful in the long term as we look to thrive to Thanksgiving. Finally, during a summer survey, we were affirmed that our incoming students at a very high level are committed to doing the things that we're asking them to do, to be compliant with the restrictions that come with living during a pandemic. So wearing a face mask, social distancing, even scheduling the use of public areas in residences to include lounges and showers and things like that, to make sure we are being thoughtful about how to stay safe together.
So Dr. Wells, President Rowe has mentioned a couple of times in this discussion data and following trends. What was most important in this process? Was the data national or regional? And how have you seen these numbers change since last Friday?
Thank you for the question. I think the national data is important, but the regional data is equally important. And we've seen the pace of the infection drop significantly recently, and that's important. And we need to see if that continues. We're in the process of building a William & Mary dashboard that's going to make it easier for us to sort of track the community infections and get local and regional information. So that's going to help to guide our decision making in the future. But it's important for everyone to understand that as a state institution, we're limited in what health information we can share about students and employees. And we're going to take great care to be in compliance with required privacy. But we'll be able to track this information and watch it very closely, the regional data, statewide data, and that's going to help to really guide our decision making.
Thank you. So this next one is the number one question that I get asked the most. People want to know how we are going to know when we're going to pivot or change, move out of a phase. What's our threshold criteria? How are we deciding if we're going to go fully online or more back in person?
I'll just set it up, but then I'm going to ask the experts, Dr. Wells and Carrie, you can chime in as well to fill in the picture. But it would be lovely if there were a single factor that we use, but there aren't. There are multiple internal and external factors. And what we're looking at is how they interact and what's the rate of change.
Yeah, I would agree. The rate of change, the attack rate, which is the most, I think, important thing, and that is really looking at the percentage of a population that becomes ill after exposure. And that's over a specified period of time. So, for example, if we see an attack rate of, 5, 6% over a period of 3 months, that's less alarming than a 5% increase over a period of 3 weeks. That would certainly be more alarming. So the rate of infection or the change over a short period of time is going to be a very important factor. We'll also look at our effectiveness of our social norming, how good are our students at mask wearing, at avoiding large gatherings, at hand washing, at social distancing, those sorts of things. So we'll be monitoring that. How well are they doing their symptom checker? All of these things that we're putting in place to safeguard infection. And our ability to isolate and quarantine, our capacity to do that, we're going to be monitoring that and make sure that we do not exceed that capacity. And then regionally, we'll be looking at our hospital bed capacity. Now, that's a lagging indicator, but it's something that we'll monitor with our partners in the community, our local hospitals. And then finally, just looking at our ability to get our test results quickly, so the turnaround time. And that's important because without getting that information quickly, we can't track and trace and isolate patients quickly. So these are all factors. No one factor is more important than the other. They're all equally important. And certainly if any other data comes out that's relevant, we'll be monitoring that as well.
So I'll just reiterate, it's a focus on a number of different factors and not just one data point or one news article that we're looking at in order to make this decision. And I want to know, this discussion so far, we've talked about the data and we've talked about plans for who is coming back to campus, but what's it going to mean? What's William & Mary going to look like? How are we going to be living and how is it going to be different this fall?
I'll kick things off there again. The thing that we're doing, I want everybody really to understand this, is that we are establishing norms, shared norms that don't exist nationally and regionally, not even in town yet. Wearing masks absolutely ubiquitously, social distancing. We're using testing with that to be able to track spread of infection and respond appropriately. We're shifting activities outdoors, we're reconfiguring the indoors, we're setting limits on the size of gatherings, all of those things. But above all, we are actually establishing shared norms. When you look at the studies that come out of the spread of COVID in any kind of congregate environment, the number one distinguisher is whether or not masks were used ubiquitously by everyone. So we're going overboard on the start on this one. We're going to be very, very conservative, and we're going to be really consistent in requiring masks. And there will be people who say, this is way overboard, but that is the right place to start.
It's also important for us to establish shared understandings and community norms. So the community commitment that was drafted really focuses all of us on campus, faculty, staff, and students, on a shared commitment to minimizing the spread of COVID-19 through the very strategies the president was just outlining. That we're committed to showing care and concern for one another, recognizing that when we comply and when we wear our masks and we keep social distance, we actually reassure the people around us that we care about them. And that's good for both physical and psychological well-being. And then that we're committed to the mission of William & Mary. We want to have a successful semester. If there is any institution that can do this, William & Mary is that place. And we want to arrive at Thanksgiving having completed an in-person semester.
So what's our track record so far, just out of curiosity?
So far, we have sent out to students through the personal information questionnaire an opportunity to read and review and check. So if you have not done that yet, students, please make sure that you do that. We are at 4,085 students still needing to affirm. So we're waiting for those affirmations to come through.
Okay, I hope they're all listening right now.
I hope so too.
And from my side, let me tell you what will be the same in the fall. And what will be the same is that we will be offering the same educational experience and quality of education that we have been offering so far. We will be offering the same personalized and interactive experience and learning process that we are known for, but it will be different. It will feel different in terms of how it will be implemented. It will be the same attention to the needs of the students, the same high quality of instruction, but it will be more flexible. It will be primarily remote, depending on the circumstances, but it will still ensure that we really together, we have come together either virtually or in person to continue the path towards achieving the education that we really are known for. So from my perspective, expect what we are known for and what you have been expecting so far. Having the opportunity to observe what happened in the spring has enabled us to put more resources and more preparation into how we'll be in the fall, but also be prepared to be mindful of the community and be consistent and obey in the sense that we feel that makes the experience collective, that measures need to be taken to protect our fellow students and faculty and staff on campus. Overall, we will be as flexible as possible and as adaptive as we can be, but still high quality.
And so I might just add, and listening to my colleagues, I hope you're hearing a theme around consistency in behavior, consistency in quality, consistency in meeting expectations, no matter what mode you're interacting with us this fall and how we're interacting with you. But I also think it's important that we recognize that all of our community is meeting this at a different place. And so the impact across for students and families, the impact for our employees, we really do have folks that are struggling and need to keep issues of equity in mind as we're working through those. So we've been very taking concerted efforts. The board, I think you all are aware, rolled back its planned tuition increases earlier this summer, recognizing the financial strain that many of our families are facing. We've put additional dollars, over $3 million more into financial aid because we know for our students and families that's important. We've increased awareness, and we heard both the president and the provost talk about what we learned in the spring and understand that the way in which our students are able to interact with us differs widely, and we need to be able to help accommodate. We've also taken a page out of the book that I think our students have provided. Our students have been exceptional in really leading the way for us around mental well-being and emotional well-being. And we're looking both to enhance activities, not only for our students, but for our community as a whole, recognizing that this is a stressful time for our employee base as well. And then I would just add, testing has been an area we've absolutely are doing more than is required from a VDH or CDC standpoint, and that's very intentional. We're also shaping our testing program, recognizing that we have employees that are on frontline positions. As I look at Dr. Wells, her colleagues and her areas are in high contact positions with students and others. Our custodial staff, our dining staff, we're being very aggressive in terms of the testing that we're providing for them and the testing that we're providing for the entire community. Also want to make sure that we have at-will testing available for employees at our expense so that they can have reassurance that they are going to have access to testing throughout the semester. Lastly, I would say equity issues are an issue or an area that we've been spending a lot of time, the president in particular, and talking to the General Assembly, the governor's office, and her colleagues, other presidents across the state, to really make sure that we're bringing those issues to the forefront and working with our partners at the state level to address issues where we see them.
Amy, you had a number of really excellent points. One of those was consistency. And this theme of consistency is so important. And I want to know, how are we going to enforce that consistency? How are we going to hold people accountable? And what are the consequences for people violating policies?
So I'll jump in on that. In prior town hall, we talked about the importance of really looking at educating first and making sure that we're really clear about what our expectations are. So we have developed a number of training videos, the modules that all employees will take part in, as will students. We also have some modules that will talk about what it looks like to step into the hard conversations of asking somebody to please put on a mask. We recognize that that's not easy, and it's courageous to step into those hard moments. We want people to feel equipped with the skills to do that. Our daily health tracking app, just launched today. The Virginia's contact tracker has been announced. So making sure we're talking about how to do symptom tracking, what that looks like, and prompting people to do that on a regular basis, and just regular messaging about our impact of how we comply, how that affects other people. In terms of accountability and enforcement, we're on the student side. I can speak to that. We're phasing in student life in a way that I think will help us to build those norms. So for example, there will be no in-person student activities until August the 28th. We've got a 2-week moratorium on recognized organizations hosting events. Our student government and our student organizations are actively engaged in accountability and enforcement for themselves. It's been really heartening to see that. All of our organization meetings will be virtual this fall, and each group will be allowed 1 event per month. And if they're scheduling an event, it will have been pre-approved and developed according to a compliant COVID-19 plan. So we're doing all we can to work with our students who are themselves highly motivated to see us succeed.
So I am not somebody that likes to be trapped or confined, and I'm wondering, what's the campus going to actually look like? How are we modifying it so that we are able to accommodate this plan forward, and that we're not confining the students to the dorm rooms?
So Carrie, maybe I'll start with that and I'll ask my colleagues to jump in. We're doing a number of things, and students, when they return to campus, will notice that the campus looks different. We're adding signage to make sure that we're clear around safety protocols. We've changed routing patterns and flows. So, stairways and things, you may go up one set of staircase and down another to try to help manage activity in our buildings and routes on campus. We're adding tents outside. We want to encourage people to get out when the weather's good. And if with tents, even a little rain won't keep us away, but to get out, have meetings outside, have classes outside where we can, gather outside in spaces where we can distance and take advantage of not being indoors. We're adding lighting, more lighting on campus so that folks will feel comfortable being outside in the evening. Putting clear space limits, making modifications to classrooms, dining facilities. There'll be more changes in terms of how students and others are flowing in and out of the dining facilities, touchless turnstiles, more takeaway dining, really making a lot of changes to what the campus looks like, how we move about campus in ways that are most effective and really consistent with what we're trying to do in terms of creating an environment that is reducing the likelihood of spread of the virus. I'd also like to add, and Dr. Ambler may want to provide some examples, but we're looking at extracurricular activities differently. Some of the things that we know our students enjoyed pre-COVID, we may not be able to do as effectively in the current environment. And so we're looking to add some additional new experiences that will keep them entertained, give them activities outside of the classroom, and be able to continue to enjoy their fellow students.
You want me to jump in with some examples, Carrie? I'm happy to do that.
Be great. I think that helps paint the picture. So thank you.
Sure. So, student organizations are the lifeblood of the university. It's how students engage in a variety of shared interests with one another. And so our normal activities fair is going to be happening virtually by content or by focus area of organizations. So we're looking at ways to connect new students to existing organizations. We're looking at intramurals differently. What kind of intramural activity can we have so there can be some healthy competition and engagement in a socially distanced fashion? So our campus rec team is being really creative in that regard. Alma Mater Productions, which is our student programming board, are thinking about a variety of events that they could do, whether that's movies in the Sunken Gardens or other things that allow us to maximize that outdoor space and also bring people together in a safe way. Lots of wellness focused activities that started in the spring will continue through the next semester. And of course, our student staff, RAs and OAs, are actively engaged in community building with our new and returning students. So they'll be the first ones doing this work in the next week or so.
Thanks. I like the visual of thinking about going up the stairs in Tyler one way and down the other. And I like the idea of seeing students doing yoga by the water. It's great to be able to actually visualize that and see what it's going to look like. I'm wondering a little bit about the instruction. So Provost, can you talk to us about the quality of instruction this fall and how it's going to be different than what students experienced this spring?
Yes, absolutely. I'm very proud of how we handled spring. We managed to pivot on an emergency basis with some 2,000 courses. But having said that, I also recognize that the remote experience that we offered was different than what our students and faculty expected and were used to. So learning from that, as I mentioned several times, we were able to identify areas which we will be used to support faculty and students. So starting with providing resources, technology, open access materials, training that need to be taken, actually used to improve the experience. We are fortunate to have the Studio for Teaching and Learning Innovation that it has offered already multiple trainings for hundreds of faculty. Actually, more than 500 so far have already taken advantage of that. So what that means is that through using experts and preparation, we are able to enhance our in-person experience, the remote experience, and also online teaching. We also rely on student partners who have been amazing and tremendous in offering their support to the faculty who would need more help regarding technology and navigating a virtual environment. We allocated funds for equipment, particularly webcams and microphones, that will be available to faculty as they participate in training or in the classroom. So finally, I want to give a shout out to our libraries and IT who have worked so hard to make sure that our students have access to materials that they need and that our classrooms and other learning environments and spaces are outfitted with the appropriate technology. You can guess that this has been a tremendously busy summer for us, but we are ready and we are hopeful that the students will realize how much effort has been put into this and see the quality improvement here.
All right, I'm going to jump in here because I'm watching the time for us, team. I want to move to the second part of the conversation. And I'm going to I think we should take about 15 minutes, not much longer for that. We wanted to do something different, which is create or offer a framework for the families that are thinking through what's the right learning environment for each student this fall. And I'm going to ask Professor Dolan to kick off the conversation and Dr. Wells to join in as well in offering the framework that Professor Dolan first published in June, a 5-point scale for knowing your risk level, thinking it through and feeling it through. So, Carrie, you want to introduce your scale? How you know your number?
Yeah, so the Know Your Number framework, it came about as a way to foster a meaningful discussion about how we can all just move forward together. And it's this idea that we are doing a risk assessment, or we have a risk assessment framework. It starts out at 1, where if you're a 1, you're on complete quarantine, and then goes up to a 5, where my 5 friends are hopping on planes and going off somewhere exotic with maybe a little hand sanitizer in their backpack. It's based in non-judgment, and it's a way to start a communication. I'm a thinker, and so I can't move forward unless I have a lot of facts and a lot of information. I have friends that are feelers, and they can't move forward until they get their feelings in order, and then they can work with facts. And so this framework really was a way to consolidate how people are feeling about their risk and a tool that they can use to try and talk to other people about where they are at any given point. And so it's important to just reiterate that wherever we are on the scale, it doesn't matter. It's just saying what's so for you, and whatever decision that you make about yourself or your family is okay. And then we're using it as a platform to communicate. And again, to move together forward we need to be able to effectively communicate.
think I just add what really I found powerful about it in the ways that we have been using it on campus to think about the fall is that it's not judgmental and it's very concrete. It's a set of reference points that can bring people who are thinking very differently about risk together to understand each other. I think one of the hallmarks of the fall has to be intentionality in those conversations. It could be very wearying to continually be revisiting what's my risk level, what's your risk level, how does the behavior that we're seeing or conducting ourselves with, how does that square up with a risk level? This makes it less hard work, I think, Carrie. That's my reaction. So for those listening, go read it. We've linked it. But offering that framework for how we consider the choice of going forward one way or the other, there's no wrong or right choice. There's the choice that's right for you as a family and as a learner, as a rising professional. Maybe Dr. Wells or...
Yeah, I think it is important because I think it puts the power back into the hands of the student and their family to sort of make that decision. And you can come from wherever you are, as, an emotional person or a thinker or however you need to view this. And it helps you to sort of risk stratify, just where you are. And I really like that approach to making a decision. And it's not just, just sort of a gut feeling. It gives you something more tangible to think about and really approach your decision to return to campus or to stay, home and work fully remotely. So I think it's a great tool, just something else to add to your process.
So we've heard what a 1 is and a 5. Can we fill out 2, 3, 4 just quickly in terms of behaviors on campus, behaviors off campus?
So I'm a 3, and what that looks like for me is that I interact with a small group of people, and I go different places with this regular group of people. The 4s are a little bit more, or the 2s are a little less restrictive, and the 4s, the 4s are a little less restrictive, and the 2s are a little more restrictive. What I think is interesting about this number thing is that it's also kind of fun. So if you talk to somebody about it and they tell you, oh, I'm a 2 and I'm a 4, it really does create a conversation that's kind of interesting and engaging. I have students that have told me that they use it to talk to their grandparents about how they're going to go to the beach in the summer and what they're going to do. And it's something that families can use to talk about where they are at any given point.
Ginger, you talked about how you see the campus itself and what it would be like, what our restrictions, our guidelines are going to be like.
Yeah, I appreciated that conversation earlier.
Yeah.
Looking at the model that Carrie has laid out, what we've described in the community commitment is basically in the middle of that spectrum. It's around a 3. What we're expecting is for people to be, so I do encourage people to take a look at that, and to me, it's a helpful tool for deciding if being on campus is the right place for a student to be, given their level of risk that they're willing to take. If someone really needs a very restrictive quarantine-like experience, that's not what is going to be happening on campus this fall. However, if someone really wants to be a carefree 5, that's not going to fly here either, because that would exceed our expectations for being compliant. The option of not wearing a mask is not an option on campus this fall. So I think understanding that we're going to be functioning at a level that is consistent with our agreement, and if students don't feel that if that's either too liberal or too conservative, that's just something to assess.
Yeah, that's great. So please, folks who are listening, go out and read it, have a conversation, and take this as the prelude to what I think we need nationally as well as here in this country is really clear, concrete, non-judgmental conversations about how we're going to manage risk for each other in the community. I can imagine roommates are going to have conversations about who comes in the room and who wears masks in the room. You'll hear a lot more about that tomorrow night, how we're framing what life will be like in dorms. But the most important part of this is open, non-shaming, really direct, exploratory conversations with each other. So I'll shift gears now and bring us back to the lightning round phase of this hour. We're going to ask Professor Dolan to sling 13 questions our way in 3 categories. We're going to try to move through them very, very quickly. The goal is 1 minute per question and answer, folks. The categories are teaching and learning, testing, and safeguarding our neighbors. Many of the questions, by the way, have answers in our FAQ, which are constantly being updated, and we can go deeper on them in the next 2 town halls as needing. So we have a lot to get through in a limited time. Over to you, Carrie.
I also just wanted to add that I'm also getting some live questions that are popping up. And so
Yep.
I'm going to integrate those in each one of those buckets that you just mentioned, the teaching and the learning and the testing and safeguarding our local community.
Great.
So we're kicking it off first with students having options to have an in-person class when they return to campus. If they get sick, how are they going to continue?
Yes, I mean, part of the preparation that I mentioned before has been to ensure that deans and program directors and department chairs work with faculty to ensure that they're ready to address this. Faculty have experience and they have been experiencing the same situation. So they take into consideration workload modifications in the curriculum, and arrangements will be made with students who are affected by this. If you are in this situation, and this is addressed to our students, make sure you ask for help. You'll find a lot of understanding, resources, and support for wellness this semester.
And I would just add that this is something that we do on a regular basis when students have an illness. So we have structures already on campus to support students, to help them communicate with their faculty, and to make sure they have what they need to be successful while they get better.
And very expanded health services this fall with a kickoff of our new Henry Street building. We're really pleased about.
So as a faculty member, I can't call in a substitute. What happens if I get sick?
Well, this is something, again, that we are prepared for because it happens during regular semesters. Maybe we are preparing more for this happening more frequently, but departments are making assessments on how to keep the continuity for the class. We have, as I mentioned, deans working with department chairs and program directors to ensure that there are safeguards and plan Bs in place for that. We are aware that this could happen. The faculty are aware, and we are preparing for this event, although we are hoping to avoid this by complying with the safety measures that we have been discussing.
So President Rowe, this is a live question that's coming in that I've heard you speak about before. So I'm going to ask you if you're willing to answer this one.
Sure.
Someone has written in and said, I'm not able to get to a 3. I don't think we can gather on campus safely, and I'm really scared. I also don't want to miss out. If I'm online only, how am I going to still be part of the William & Mary community? What do I do if I'm not a 3?
Yeah, that's incredibly important. So first thing is we've been thinking about students in this situation from the beginning. And we are designing the experiences here so that they bring together students who are off campus and students who are on campus. A great example, Ginger, you might chime in, is the way that we're thinking about student groups. Do you want to say a little bit more about that?
Well, I think, the fact that our student organizations are going to be gathering virtually means that whether you're on campus or at home, that you can still be actively engaged with the peers that matter to you and take part in those activities. So, the outreach is really important, and the communication is important. And so much of what we're going to be offering is going to be both in person and virtual. That's both in the class and out of the class. That community can be reinforced that way. It'll be different. It will be different. It will feel different, but it's not going to be absent.
Right, and in community celebrations, in one-on-one conversations with faculty who also know and are preparing for this. I think this is incredibly hard, but just we're there. We're there to listen and be creative and make sure that you're part of the community and the planning process and the imagination of what this year is going to be like. All of us are going to face this in one way or another this year, I think.
And I would just also add, we've been practicing this since March in many areas. So doing career counseling virtually, doing teletherapy, telemedicine. We are working very closely with students in meaningful one-on-one ways. It's just in a different mode.
So I have another live question, and I'm going to ask the provost and maybe Dr. Ambler, this one is for you. It's talking about support in terms of tutoring being available to students, and specifically asking about the library and what kind of resources they can get. It further goes into asking about professors and whether or not they'll be accessible by Zoom or by phone or by email. It's another connection question, also related to learning.
Yes, and I'll start and then hand it over to Ginger for more details. The faculty are available and will be available, and they're very supportive of providing, as I mentioned before, a personalized experience, which means that there will be one-on-ones, there will be interaction. Sometimes this interaction will be regular, sometimes it will be on demand. The library also is making preparations to be the space that our students feel that provides the support that they need, either physically or through the materials and the support that they will be providing. So on behalf of that side of our support network, we will have everything in place for everybody to be able to get that part of the experience with the library, with the faculty available, and the tutoring as well. Ginger, on this?
Sure. So our academic enrichment activities will continue and be offered again, both through in-person opportunities and through virtual opportunities. So whether that's workshops on time management or how to prepare for an exam, how to successfully read a textbook efficiently, or it's tutoring through our Tribe Tutor Zone, that these are services that we're looking at making available regardless of whether it's an in-person or a remote option.
Carrie, I'm just going to jump in and make sure that everyone knows we're going to have a chance to go really deep on these kinds of questions for families and students, just you guys, tomorrow. So I want to make sure also we get to testing, since that's the #1 question that's coming my way.
Yes. So many people want to hear about this testing. And so could you just tell us a little bit about the university's plan? What do we need to know? And now in light of the changes that were announced just this past Friday?
President Rowe, I'll start, and certainly I know many of us on this panel have been involved in working through what the testing protocol should look like. So in general, we're really focusing our testing around sort of 4 major areas. First is the return to campus. And so that's where we're getting a lot of our questions right now, understandably, because that's the phase that we're in. But as we've said, we're testing students, and as the students hopefully know, testing students before they return to campus. They will have to have a negative test result prior to coming to campus. Likewise, we're testing, I mentioned earlier, employees that are in particularly high contact roles, testing them as well at the start of the semester so that we can make sure that the initial return, we are bringing folks that are testing negative. I will say we're starting to get those test results, and overwhelmingly, we've already gone through a number of our employees and really successful results. We've had a couple, 2 literally, that have tested positive, and they're working with their providers and won't be assigned back to work until their physician releases them back to work. So it's working as intended. We've gotten some initial results for our students that are returning early this week. Again, those have come back negative. And so we're working as we intended and helping to ensure that we're starting the semester in the right place. Ongoing, once we're back, we're going to be doing ongoing prevalence testing. As you know, if you've been watching the news and the medical reports, many people with COVID are asymptomatic. And so it's going to be really important that we're sampling the population and understanding If we're seeing a rise, as Dr. Wells talked about in terms of our positivity, we'll be doing sampling on that in a routine basis for both students and employees. We also recognize that there may be students that are symptomatic, and so those students will be working with the Student Health Center and working with the physicians and the medical team there to do testing if the physician believes it's appropriate given their symptoms. The other area briefly earlier for employees, obviously many will be tested as part of the ongoing sampling. But if you're an employee and want to be tested, we'll have low-cost tests available for you at the testing center that's being staffed by VCU Health. And then finally, at the end of the semester, runs right up into the Thanksgiving holiday. And we know that for our students, many of them will want to be returning home to family and friends. For our employees, we also know that they'll want to either be opening up their homes or visiting their family and friends. And so we'll have end of semester testing available for students and employees so that people can feel comfortable and hopefully celebrate the holidays with loved ones. All of that, I continue to say, William & Mary is being very aggressive in terms of its testing protocols. We're working actively with VCU Health in monitoring the testing process, helping us to navigate through that as we work through the semester to make sure that we're bringing the most current testing protocols that we can to bear, realizing that the science and the testing is evolving over time. We're doing this largely at William & Mary's expense. So the testing that we're doing of students, the sampling that we're doing for employees, we're doing that at William & Mary's expense. And we're doing that because we think it's such an important part of having a healthy community and having folks understand and feel comfortable in the community that we live in. In terms of timing, I think, Dr. Dolan, you asked about timing. Friday's announcement doesn't change the overall kind of testing we're doing or the way in which we're testing. It does change the timing a bit for those students that won't be coming back as early. And so we will be modifying the mailing schedule for those students so that we ensure that they're getting tests at the right time frame for when we expect them to come back again.
Amy, can you just quickly say a few words about privacy? Because I think one of the questions that has come, variations of it that have come in recently a lot have been about, is Calico protecting privacy? Is there surveillance that we should be worried about? And I am still watching the time. We got 8 more minutes, but this is an important one.
It is, absolutely. And it's one that we take very, very seriously. So we've spent a lot of time with Calico and with our partners at VCU Health. The data is being shared for the student, and part of the reason for the app that we're using is to be able to quickly provide test data to the individual. I mean, one of the things that we've seen nationally is the lag in being able to communicate test results. That's one of the advantages to the testing structure that we've put in place. But our Chief Information Security Officer has been working very closely with the Calico team, and we have a very rigorous set of credentials around what we expect of our IT partners. And we're not using the data in any way. I think I've heard people say you're using this as surveillance or tracking me in some way. That is not how we're using the data. We're using the data, one, to inform the individual, and then to understand where we're seeing changes in positivity rates across the campus.
In aggregate.
There's
a cluster of questions about what do I do about the schedule of testing? What if the test doesn't arrive? And some other questions, Ginger, about what happens if a student tests positive and how we're handling quarantine. I wonder if we could roll those into tomorrow's conversation as well.
Sure.
Yep.
Specific.
The other thing I would just add, we actually, I think today posted a FAQ specifically around testing because we know we're getting a lot of questions there. And so I'd encourage folks tonight, particularly if you're going to tune in again tomorrow, take a look at what we've already posted. That we've taken those directly from the questions that we've been receiving. So hopefully that'll answer a lot of the questions, but at least will serve as a foundation maybe for a more in-depth discussion tomorrow.
Jump in for a minute because I want to make sure that we get a chance to talk about safeguarding our local community. And so how has the William & Mary's path forward incorporated protecting the local community? Specifically, what role is the university going to play in discouraging students to have parties or from attending big, large off-campus events?
So the important thing is that the community commitment specifies this is behavior we expect on and off campus. So the mask wearing, the social distancing, not gathering in large numbers of people in an unsafe manner is what we expect of our students on campus, and it's what we expect of our students off campus. I also mentioned the moratorium on recognized organization activities for the first couple of weeks and training to try to reinforce our expectations. There will be sanctions if there are violations, either for an individual or for organizations. So, we have a mechanism through an email address, covidconcerns@wm.edu. If there is a concern that someone has in the community, the COVID team wants to know about it so that we can respond, because we take this very seriously, and we'll respond with consequences as appropriate.
Maybe spell those out tomorrow as well. I know it's a progressive sequence. I think you've spent a lot of time thinking about that, and that would be helpful for families to hear and to set everyone's expectations very clearly.
Mm-hmm.
And in tomorrow's conversation, a live question that's coming in that I think is important is to define what we mean when we're saying wear a mask. Does it have to be a certain kind of mask? Can we wear a gaiter that we can pull up and down? Those kinds of questions. So if there's a place for that tomorrow, I see that coming in from our live stream, and it would be great to be able to address that. Coming back to safeguarding our community, what steps is William & Mary taking to reassure our local community that we hear them, that their concerns are something that we hear, and that we understand the importance of safeguarding the health and safety of our neighbors as well as our students?
I'll field that one. I will first say our training videos, which are going to come out very soon, answer the mask question, which ones very concretely. Well, they can be addressed tomorrow too. We're working very closely with the city council, the mayor and city manager, neighborhood leadership, and also the Chamber of Commerce to think about how we can establish, well, several things. First of all, how do we share out the principles that Ginger just shared, that on and off campus, it's the same set of really consistent guidelines about protecting the health of others, and that we're going to have consequences for folks who can't hold to those guidelines. And we're going to work really hard to help people hold. No shame, but really serious about this. Second, we'd like to invite the community into that community commitment. As I said, the nation and our region hasn't shared and hasn't developed a common set of norms, and we need them. We really need them to be able to make it through this pandemic together rather than apart. And we will be much more successful if all of Williamsburg joins us in them. So I don't want it to be the case that it's only students down on Duke of Gloucester Street wearing masks. So we're reaching out to those communities, meeting with them, publishing those guidelines, and thinking about how we can more broadly develop a regional community commitment that's like ours. Off campus, we are asking students to have know your number conversations with their neighbors, actually engage and work through that to understand who are your neighbors and what are they going to need in terms of confidence that they can feel secure. A couple of things I will say just before we finish. We don't have any evidence from the spring that having students in town, there's roughly 2,500 students who have 12-month leases. They weren't all there, of course, but we don't have any evidence that increased infection in Williamsburg. What we do have is a lot of evidence that the students who were here were tremendous community citizens. So you can read stories, for example, about the Meals on Wheels that were delivered, tens of thousands of them in the spring, organized by a student who's now a resident on city council. What that means is that the presence of students, when we do it right, can actually protect the community. And I know we think of students partying and they're young adults, and that's losing track of the future is part of young adult life. But I think we have evidence that we have a special community of students here that I believe are going to be really, really respectful of the folks who are most vulnerable. And so we're going to work with you in the community to get to that shared community commitment. It's our hope that we see it very, very quickly.
Thank you. So we just have a minute or so left, and I think I'll kick it back to you to close us up and add any final thoughts that you might have, President Rowe.
Well, first of all, just want to thank the participants and everyone who tuned in. It's an hour. We're trying to use it very, very well to get through as much as possible. Tomorrow night we can go deeper on the questions that students and families have. So do keep them coming in. I'll say, I've said it before, but it's really true. The questions that you send are the ones that teach us what we need to communicate better on, and how we need to think broadly about the needs of our community. We want to give you a strong and concrete sense of what it's going to be like on campus this fall. Same for employees. The town hall on Tuesday, we're going to be working through similar questions for employees. So um, we're looking to partner on this. We won't be successful this fall if we don't do it all together. And we have a lot of confidence in this community and the resourcefulness and care that we can bring to being consistent in the ways that are required. So thank you all for tuning in. Stay well, everybody.